Hello friends, Namaskar. I'm Dr. Ramya Kusalkar and I am a consultant psychiatrist in Thane. And this is the third video in the series of schizophrenia facts. Well, this was announced quite some time back, but it has been a long time since the video has been made. I have been a little busy in the past few days and apologize for the delay. Today we are going to discuss about the treatment of schizophrenia. So, treatment of schizophrenia is a comprehensive topic. So I have decided to divide it into small subtopics depending upon the presentation. So in this video, I'm going to talk about treatment of first episode of schizophrenia. The first time psychosis is encountered in schizophrenia. So even in the first episode, there are two possible scenarios that come up. One is when the patient is behaviorally unstable, meaning that patient is aggressive because of the delusions and hallucinations and the increased severity of those. And the second scenario, patient is behaviorally not that unstable. Okay, so both have different approaches of treatment. The first scenario, patient requires to be admitted. In the second scenario, the patient can be treated on OPD basis. The medications may remain same, but the form of delivery of medications is different. So once when we admit the patient is given medications in the injectable form because such patients generally do not accept medications orally, and it is difficult for relatives to keep the patient at home, and that is why they also prefer to admit. So the ultimate goal of admitting the patient is that the aggression or behavioral disturbances have to be controlled fast because they are detrimental for the patient itself and for others also, those are around him. And ultimately, these injectable medications are then started in oral formulation only. But during the process, during this entire process, which we call the acute phase management of schizophrenia, the patient is counseled or assessed every day to note the changes in his thought patterns, note the changes in the conviction with which the patient holds the beliefs that has caused him to land in this hospital. So gradually over a period of time, those beliefs start becoming shaky, and then we counsel the patient regarding why they become shaky, what is the role of medications in them becoming shaky. We challenge those delusions on the basis of evidence, real world evidence. The ultimate objective is to make patient realize that the patient is suffering from some mental illness because of which such thoughts are coming, and the reason to take medications is to keep such thoughts away, to keep the mental illness at controllable level so that it does not disturb his life. So when the patient is admitted, there are two modalities of treatment options available. One is, as I said, injectable medications. They are faster, but there is another modality available which acts even faster and is reserved for that purpose only, and that is electroconvulsive therapy. Now, electroconvulsive therapy is a little worrisome for people who don't exactly know what it is, because there are a lot of different kinds of opinions that are prevailing in the community. But mind you, friends, this is a very safe therapy because the preparation that goes into the ECT is exactly the same as the preparation that goes into any surgery. There is anesthetist, there is a team of anesthetists that are there to manage any kind of situation if it arises, and it's a very safe and fast acting therapy. So patients who are very disruptive, who have very severe symptoms and who do not respond to medications, and also patients who require to be treated faster, like a lady who is pregnant in 8th or 9th month immediately after delivery, where there we cannot afford delays. So such patients in first episode of psychosis are also treated with ECT. Okay, gradually they are also shifted on medications and insight is built in them, and they are educated about their illness along with all the other patients that I discussed. So friends, this is the acute management of an episode of schizophrenia. Now the most important thing is to educate the patient about illness, to educate the patient about the need for taking medications, to counsel the patient about medications and their side effects and how they can be prevented, to encourage the patient to follow a diet schedule for that, to psychoeducate the family members regarding the disease, the disorder, and so on. And this is not a one-time process, it continues throughout till the patient is taking medications. So, as per guidelines, the first episode is treated for 2 years, and then if there are no symptoms for 2 years, the medications are gradually tapered off and stopped, and we give a chance to see whether there is recurrence or there is complete cure. So this is how the first episode of schizophrenia is treated. If you find this video informative and if you have learned some interesting things from this video, please like the video, subscribe the channel, and wait for the further video.